I was diagnosed in February of 2014 with stage 3 breast cancer. I had a double mastectomy as part of that treatment, and then I finished 2 rounds of chemotherapy and then a round of radiation therapy. All that took about 9 months. About 6 months after that, I started noticing signs of lymphedema.
Lymphedema is an unfortunate complication of breast cancer surgery at times. It can happen to any patient that suffers some sort of trauma to their lymphatic system. It's almost like having a blockage on a highway. It can be fairly uncomfortable for a patient that their arm can swell up to, easily 1.5 to 2 times its normal size. It can affect your activities of daily living and certainly impacts your survivorship.
I would get really swollen, and then as it was swelling up more and I wasn't able to get it down with standard compression, I would start to get pain in my wrist.
Jill was the ideal candidate, and she had symptomatic lymphedema that she was seeing a therapist for.
The standard lymphedema therapist would do their, what they call aggressive wrapping. The sleeve just kept being less and less effective. I was very comfortable with Dr. Chong. I mean, he's such a nice guy and a good surgeon. He explained it to me a little bit, and I was like, okay, I trust you, and let's do it.
A lymphatic venous bypass surgery is a very physiologic way of addressing the problem. It's actually really quite simple, and it's elegant in its simplicity. The easiest way to do it is to actually drain that lymphatic vessel into a vein, kind of bypassing the area of occlusion or the area of damage. The patient's brought to the operating room. I make a small incision, it's just through the skin, find that small lymphatic, we take the microscope, we find the lymphatics, we find a very small vein adjacent to it, and we just hook them up together so that congested lymph flow can now go drain into the vein. The patients that get the best results are where we can find several areas of congestion and then bypass them into a vein. Recovery time is pretty quick. As I mentioned, it's just under the skin and they're very small incisions. These patients go home that day, which is a great thing. They have a loose wrap on their arms. Eventually I transition them after about 2 to 3 weeks into more of their compression wraps. Colorado health system is actually the forefront of breast cancer care. We're the only ones that I know of in the state that have done the operation and provide it. And what marks us special is that we have folks here that are experienced in doing the operation. Very qualified, passionate specialists who are focused on helping patients with lymphedema, not just in the arm for breast cancer, but all over, even for the head and neck and the groin for pelvic disorders. Most of my patients are pretty motivated and they get back to work right away. I can tell you so far that we've not had any patients suffer any complications from the lymphatic venous bypass. They've never developed worsening lymphedema, and I've not had any patients develop bad infections. And I treat all these patients as outpatients.
It went great. I was very happy with it, and I had full mobility within 4 to 6 weeks. After being through so much with the breast cancer, and then to get that lymphedema on top of it, it's like, another thing I have to deal with. And if you can get even a little bit of relief from it, then it's worth it.